Welcome to the Medical Center Show. Today we're going to talk with one of our new doctors, Dr. Park, who has United Medical in Bayonne. He's a new member of the Barnabas Health Medical Group, and we're very, very excited to have him here with us today. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Park, one of our new members of the Jersey City Medical Center Barnabas Health Medical Group. Dr. Park, welcome. We're so glad that you're here today.
Glad to be here.
You know, you've been a great addition to the medical center. We've really enjoyed working with you in the very short time that we've known each other, right? It's been really great.
It was a good experience.
Yeah. So tell us a little bit about the history of United Medical, because you guys are one of the biggest providers in Bayonne now. Yes. And now you're part of the Barnabas Health Medical Group and Jersey City Medical Center. But tell us about how you got started.
Yes, it was about 7 years ago that we get to know one of the big practices in town, Hudson Medical Associates.
Okay.
What's the name of practice?
Right.
And there were Doctors Hoffman, Nino, and Dr. Wozniak, and the managing partner, doctor of the group, and 3 more doctors. So it was a big practice.
So they were already established in Bayonne?
That's right.
And they had about 7 doctors already part of that group?
Part of the group.
Okay.
Somehow the practice ended up almost dissolved by the time I get to know about the group.
Right.
One of the doctors came to us for employment, and I asked what's going on, and it's a very poor management, poor leadership,
right,
and ended up, almost dissolving. All the doctors are leaving.
Wow.
That's why he needed a job with us. So I asked more about the practice.
So at the time, did you have a practice in Bayonne at that time?
I did not.
You did not,
no,
okay.
okay.
But you knew these guys, sure.
So one of the doctors came us for job interview, and I found out about the practice, and I saw a potential there if I came and regroup it and manage better, provide all the resources they need, would have been a good opportunity to help practice stay in town, helping the service,
and really service the community,
patients.
right? Yeah.
Yes, service the community. Because at that time they were seeing about 10,000 patients of Bayonne population.
Wow, that's big.
And it is 10,000 patients in shock to find a new doctor.
Right.
So, thanks to those doctors remained at that time, the key doctors, Dr. Wozniak, Dr. Hoffman, Dr. Nino, 3 of them agreed to stay in the new management
Right.
on the name of a United Medical,
Okay.
PC.
And then you joined with those 3 doctors to form
Yes.
that United Medical.
Yes.
Okay. So it was your expertise, though, that really kind of kept everybody together, right? I mean, you do a
That's
great
right.
job of managing that practice, right? I mean, it really is a unique situation.
Yes, I'm happy to say after 3 years,
Right.
we added more doctors, not only internal medicine, but more specialists added, and grew out of the space. At that time, we were located in 27th Street between Avenue E and Broadway.
Okay.
Um,
And you started with 4 doctors, and
Yes.
you grew now to how many?
in group, 25 doctors.
You have
we now.
25 doctors at United Medical?
Yes.
Wow. That's like that's kind of almost like the Cleveland Clinic. I mean, you know, you have 25
Getting
doctors in
there, on the way,
Bayonne, right?
on the way.
Because you
Yes,
must
yeah.
include all the subspecialties then, right?
Yes. Yeah.
Yeah.
So we moved from that location to, we built our own medical facility
Right.
on between 48 Broadway and 48th Street on the corner.
Right.
We built a 20,000 square foot of building
Right.
for our use,
Right.
and we occupy and service better.
I've been there. It's a beautiful building. I mean, I
Thank
know. I complimented your wife because I think she's the one who designed it, right? I mean, and
Yes.
helped interior decorate it because it's just a beautiful facility.
My wife is an artist.
Oh, she is. So
specialized
that's
in
yeah.
color.
There you go. So
So-
even just when you walk in, it's such a beautiful facility and
Thank
brand
you.
new, right?
Yes, it is.
Something
Yeah,
you should
3
be very,
years.
very proud
Mhm.
of. Yeah. So there's 25 different doctors that work out of that. So you really pretty much can. It's like a one-stop shop for people, right?
That's right.
Yeah.
The patients come. There's a great, from the very start of my career, I noticed that there's a great inefficiency in medical practices, especially small,
Right.
solo practitioner's office. The first inconvenience is redundancy. Write a prescription, handwriting,
Right.
the charts, calling patients, and it was not. There's no automation, and
Right.
it's very inconvenient. And patients come in, see a doctor, and then go to another doctor. It just takes a lot of time for patients, waste of their, livelihood,
Right.
with the product, all the time and money in seeing a few doctors in different locations. So I had this vision that it should be more automated. The efficiency has to be improved, and patients should be served better. So I invested heavily on management part, especially computerized
Electronic
medical
record
records.
Right.
And
So when a patient comes into your facility now, everything's electronic?
everything's electronic,
Wow, that's amazing.
no paper at all.
So when they get a prescription, you just send the prescription to the pharmacy? You
Yes.
don't even have to give them a piece of paper when they're leaving?
Unless it's a controlled substance.
Oh, then you have to, okay.
Then
that's
you
right.
have to write
Right.
a prescription.
Right.
Otherwise, we can either fax
Right.
or e-send.
Right.
So another benefit for the patients is when they go to the pharmacy now, they don't have to wait for the prescription
Because
to
it's
be
there
filled.
already.
It's there already waiting for the
Wow.
patients.
Wow.
So it's a
Well, we're going to
huge
talk a little bit
benefit.
about the benefit of having this multi-specialty group in Bayonne.
Mhm.
But, the people of Bayonne should be very, very grateful to you. I mean, you think about having 25 doctors that you literally saved from leaving Bayonne and starting this practice and really having a one-stop shop in this beautiful brand new facility. I mean, you even have parking underneath the
Yes,
the building.
17
So-
cars.
I know. The first time I went there, I was like, wow, he's got a parking garage and everything right underneath. That really means really very, very convenient for your patients, right?
I'm grateful to Bayonne patients
Yeah.
that they well accepted us and supported us.
Right.
And the town officials were very supportive.
Right.
It was just appreciated the whole Bayonne
Yeah.
community.
It is a beautiful state-of-the-art building. I mean, it's just decorated so well. I mean, seems like you got kind of everybody working
Yeah.
together to really focus on what the needs of Bayonne patients are.
One thing in design part is we tried to make it not like a dentist office
Right.
sterilized.
Right.
We made it more
Right.
ambient,
Yeah.
open and colorful, so cheery,
Yeah.
know. And the
Well-
artworks to
To make
calm
people
patients.
make people feel
That's
good.
right.
Well, we're going to talk a little bit about why patients should feel so good about coming to your facility when we come right back. We'll be right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Joe Scott with the Medical Center Show. We're here with Dr. Park, who's part of Jersey City Medical Center, Barnabas Health, and the United Medical Group in Bayonne. So we were talking about this great multi-specialty group that you literally saved in Bayonne.
Right.
And built a brand new building. You now have 25 doctors. That's got to be so much better for patients to have this one-stop shop, right?
I hope so.
Yeah. I mean, so a patient comes and they may see you. Tell us a little bit about kind of how that process works and why it's so good for patients.
Well, a patient comes in and see a doctor, and then you're referred out, and you have to wait for the appointment.
Oh, yeah, that's right.
And then
So
reports
if you didn't
come
have
back,
those
and you have to
25
come
doctors,
back.
yeah, they'd have to go someplace else. That's right.
That's
yeah,
right.
So you have all those different specialties.
Right. Using one system,
Right.
electronic medical records, so you don't have to give a chart to another doctor,
Right.
bring it back. It's just very convenient.
So it's
and
seamless. So-
Nothing is lost
Yeah,
in
so,
between.
so you're the internal medicine doctor. You see the patient. You say, you know what, this patient really should see a urologist. They can go right next door, and the doctor can sign on to the medical record. I mean, it's like seamless. That's
right.
amazing.
Yes, and internally, doctors communicate about patient care. Every time, real time, they meet each other and
Right.
discuss about the patients. It doesn't have to be another appointment.
So it's
over
right
the
there.
phone. It's right there between
Wow.
doctors' communication. Too.
Wow.
Yes.
So you, well, first of all, you are largely responsible. I know you and your son are largely responsible for managing the practice. And I know that that's created a big, big difference. Like you said, there were management problems before.
That's right.
Yeah.
Yeah. So we made it efficient
Mm-hmm.
and a better service to the patients. But we thought we should really prove ourselves how we are providing good quality care to
Right.
the patients. And if anyone knows about it, there's a organization called the NCQA, National Committee of Quality Assurance.
Right.
It's a national organization that kind of grades the healthcare offices or the
This is for outpatient.
Outpatient,
NCQA are quality measures for outpatients.
outpatient
Right,
care,
right.
or
Or physician
even
care.
hospitals.
Yeah,
And
sure.
NCQA
Sure.
accredits all the
Sure.
healthcare facilities.
Mhm.
And among that, what it applies to us is primary care,
Right,
patient-centered medical home.
right.
And you have to do about 6 months of work, report what your practice is about, and if you meet certain criteria, so you pass and you get accredited for your primary patient to send to the medical home.
Right.
It's going to be a buzzword soon.
Right.
Uh,
So it's kind of like our A rating at the hospital, right? This is an
Right.
A rating for a physician practice who gets certified as a patient-centered medical home.
yes.
So some of the things I know, there's indicators that you have to report on. So it sounds to me like you've got this medical record, this multi-specialty group, these indicators you need to meet.
Yes.
And you've got the ability to kind of pull that all together in
That's
one
right.
location. That's amazing.
Yeah.
right?
Yes, they helped a lot, such as how well they monitor how well we are taking care of diabetic patients.
Wow.
That's indicated the A1C levels, how we are doing. It's not controlled. How actively we approach patients and help patients to get control their diabetes better,
Right.
high blood pressure better, weight control. All those measures, the items are computed
Right.
and came out. We are certified as a level 3, level 3 being the top.
That's the
And
highest
there are
level
only
patient-centered medical home?
Yes.
Wow.
As I know, there are only 3 or 4 practices in state of New Jersey having that qualification.
Wow, only 3 or 4 in the whole state of
Yes.
New Jersey. And there's got to be hundreds of thousands of practices in New Jersey. So that's really amazing that you were able to achieve level 3. But I do believe it's because of, 1, your management. 2, you got multi-specialty, right? And then
Right.
3, you throw that medical record on top of all that, and
Yes.
boom, you're able to really get to the highest level.
Yes.
That's amazing. That really is. I know David's working very hard on your computer system. You know, the funny thing is when we
Right.
first met, we talked about your computer system and the fact that you pretty much grew it based upon what the needs of the physicians were in your office, right?
Yes.
And so you're
That's
able to kind of manipulate it as you kind of go along.
Yes.
Yeah.
Instead of using big program that IBM makes, all those
Right.
big programs has very difficulty in meeting individual doctors' needs.
Right.
Compared to our homegrown program,
Uh-huh.
we can easily adapt whatever the doctor's need
Right.
is. So we can customize our product readily for the needs our doctors,
Right.
ask for.
Sure.
So it's a huge benefit in that.
Well, that's got to, we talk about quality all the time, and we talk about really trying to keep people out of the hospital and keep them healthy in the community. When they come to see you, I mean, you really have the infrastructure in place
Yes.
to facilitate that at the highest level.
Yeah.
Yeah, that's really, really amazing. I especially love your computer system. The fact that
Yes.
you've homegrown it and you kind of can manipulate it on an ongoing basis makes a big, big difference for patients.
It helps doctors to treat patients better too.
Right.
Because by the patient's age,
Right?
sex, and the chronic medical condition, you put this information and it generates all the data that we have to monitor, such as how often you should do blood sugar test, cholesterol level, blood pressure measurement. It gives you all the data, the flu
So
shots.
do things like mammography
Yes.
and, I mean, all
Cancer
of the,
prevention.
Yeah,
It generates.
how many, like when they should get a colonoscopy,
Yes.
it tells you immediately all that.
Immediately individualized care list comes
Wow.
out.
Wow.
And it says also if we do the test
Right.
and put the data in, it records. So whenever you open it, it shows what's up to date, what is to be done, what is how much overdue, and we call list comes out.
Wow.
So we remind the patients constantly what's missing in them, overdue,
Right.
and try to help patients to
Sure.
get good care. Yeah.
So I would imagine, and we're going to talk a little bit about what you're going to do for the future, but I imagine one of these days, patients are going to be able to have that list readily available to them, probably on their
Yes.
iPhone, before
Yes.
long. I'm sure that's the next iteration.
It's
of all
already
this.
happening. Yes.
Is it?
Yeah.
Okay.
Microsoft has a health vault,
Wow.
and these qualified practices can report their patients' blood test result, and there's a health data
Wow.
into health vault, and they have an account to health vault. They can check all those data.
All right, we'll be right back with Dr. Park. We're going to talk a little bit about this health data and the future of United Medical. We'll be
Thank
right
you.
back.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Park from United Medical. His office is at 48th and Broadway in Bayonne. We're very, very excited to have you as a new part of Jersey City Medical Center and Barnabas Health. So we're talking about electronic medical records and kind of the future for patients. We were talking about, before long, you're going to take your iPhone out and you'll be able to see your complete electronic record, right?
Yes.
Yeah, that's great. So what other things do you think, what's the future for United Medical and what we're doing in
Yes, we'll continue to grow
Right.
and continue to grow for the better service to the patients.
Right.
Under one roof,
Right.
comprehensive care,
Right.
focused on prevention,
Right.
and provide all the assistance to patients, such as accepting all the insurance, almost all the insurances.
Oh, that's right. We didn't really talk about
Yes,
insurance because,
yes.
there's big insurance issues in Bayonne with the
That's
hospital
right.
being out of network, but you accept most insurances?
Almost all the insurances.
Okay.
One good part of another thing that we are qualified as NCQA Level 3,
Right.
patient-centered medical home, is that some insurances actually have patients pay less copay,
Really, because
choosing
of
our doctors.
wow.
because
now, see,
of our
there's a direct
qualification.
impact to the patient.
Yeah.
How much better is that for a patient? So, if the insurance company says these guys are the best, they've
Yes.
got the best scores, they're at the highest level, the best quality, you actually go there, you pay less of a copay because the insurance company wants you to go to your practice.
That's right.
Wow.
Also, we not only quality care, also cost of care is concerned.
Right.
We use less, spend less money for the patient's care because all the conveniences are in one place. Since we are using one electronic medical record, a patient does not have to go for duplicate tests.
Right. So if someone had a CAT scan and they had a
Then-
paper record, chances are you're not going to be able to know that
That's
they had that
right.
CAT scan, right?
And
But now
order
with your
again.
record, you can see it all the time, so
That's
you
right.
don't have to repeat it.
That's right. So
Yeah.
the insurance companies recognize that we are providing quality care at the same time,
You're very
spending
good.
less money, so they
Well, not only
recommend
that,
us
but
to.
think about it. I mean, if you're the patient and you have a CAT scan, if you don't have to go back for another one
That's
because
right.
you've got it right there in the record, to me that just makes all the sense in the world and is really the best thing for patients, right?
Not only CAT scan, EKG, blood test, and
Right.
a lot of expensive tests has been done again and again. Not only cost, but inconvenience to the patient, and sometimes it's a health hazard to
Yeah,
patients.
yeah.
So we are proud to provide, under one roof,
Right.
comprehensive care
Right.
at the convenience of patients.
Yeah. Are you looking to add more specialists to
Oh,
your?
yes.
So what are you looking for?
We'll not stop growing for the benefit of our patients.
Right.
So we'll provide the best care you can get in the nation,
Right.
locally in Bayonne for our patients.
So can patients just call up and get an appointment, or
Yes.
we're going to give information out to everybody about how they can reach you, so are appointments readily available?
Readily available,
Right.
and especially emergent care.
Right.
We try to provide it in our office.
Okay.
Instead of sending them to emergency rooms
Right.
or
Yeah.
other.
So they can
urgent
walk
care.
into your office?
Yes, we
Wow.
accept walk-in patients as well. Not 100% all the time,
Right.
but for the urgent patients, we always accept the
Yeah.
patients.
Are you open in the evening time, or what are your
The
hours?
office hours are like from 8 to 7, Monday
Oh, you are.
through
Okay.
Thursday.
Right.
And Fridays, we open 8 to 5.
Right.
Saturday from 8 to 12.
Wow.
So extended hours,
Sure.
more availability,
Yeah.
and better service as well.
Yeah, no. That way patients can get in to see you. But what I think is the absolute best is the multi-specialty component, the fact that you all kind of talk using your medical record, and then that's led to you getting the highest quality, recognition. That's what it's all about, right?
That's right.
That's how you differentiate yourself from so many other doctors.
And we're happy with what we achieved
Right.
and are recognized by our Bayonne patients.
Right. We want to have a big presence in Bayonne, obviously, as part of both Barnabas and for Jersey City Medical Center. We've always been a big provider, but now with you as our partner,
Yes.
I mean, we help facilitate getting patients for diagnostic tests over to the hospital. I
Yes.
mean, we really worked very well to make that happen, right?
Yes, like a glove in hand.
Yeah.
It's one system, better communication,
Right,
and help support each other for the better care of the patients,
Right.
convenience for the patients. And the report we're getting back from patients who
Mm-hmm.
referred to Jersey City for various tests or admissions
right.
come back with a very happy, good
Very
response.
happy?
Very
Good.
happy,
Good.
and they.
Well, we put a lot of focus at the hospital, just like you. It's all about really managing up, right? And getting
Right.
people to really recognize that we want to treat every patient as if they're, your own family member. I know that's how you treat patients at your practice. I mean, and all those doctors are all working so closely to make that happen.
Our number one concern is patient health care, quality care, and patient satisfaction with our
Right.
services. One thing I stress to my doctors, educating the new hired doctors especially, I stress them, I make a very important session how to take care of patients. And my advice to them is, during this moment, that appointment, you have a sitting patient to the face-to-face.
Right,
At that moment, you should think that this person is the most important person in my life
right,
for this given time.
right.
Then, the patient will, appreciate it, and in no time you will be the best doctor for the patient.
Yeah, I mean,
And that's the best piece of advice I could give.
the truth is in how many new patients you get every year. I mean, you just
400 new patients every month.
How many?
400 new patients
every
month in
Oh
3
my gosh.
locations.
Isn't that really what it's all about? It's really when patients, you see that kind of growth,
Yes.
400 brand new patients every month. That really is telling. I
Yes,
mean,
yeah.
patients know that they're going to get the best care possible. Multidisciplinary, using that electronic medical record. Eventually we're going to send all that information to their iPhone, probably with reminders and everything else
Yes.
about, when their next appointment needs to be and all that good stuff.
We just make sure we are in the forefront of all the new developments. and
Right.
We will be in the forefront, not trailing, and someone
Right.
tells us to do, and we
Right.
are out there and be
You're-
a first
Yeah.
runner.
Well, I can tell that. I mean, just developing your own electronic medical record,
20 years ago.
and making it so physician-friendly so they use it
Yes.
and make that seamless communication among all those different specialties, that's the best.
Yeah.
And the fact that you got the quality award, right? And that you're
Yeah.
the highest level quality for ambulatory services in the area. So that's really great. Well, we're so happy to have Dr. Park with us today, and you can reach Dr. Park through his office. We'll have his contact information, and he's at 48th and Broadway, and we're very, very excited to have him part of Jersey City Medical Center, Barnabas Health.